Hey guys, my name is Christina Stoops, and this is my OTD Capstone Preliminary Proposal presentation. I've decided to title my capstone Educational Tool for Foster Parents Accepting Special Needs Children. Purpose. The purpose of this project is to conduct a scoping review analyzing the existing literature on foster parents and their preparation to accept special needs children. From that scoping review, an educational tool will be created to assist these foster parents in caring for a special needs foster child. Statement of the problem. New and existing foster parents are not properly prepared to take on foster children with special needs and would benefit from an educational tool to assist them in adequately caring for these children. Background. Children who are living in foster care with disabilities are at a higher risk for institutionalization, have poor educational outcomes, are on a higher risk of being on psychotropic medications, and are more likely to be mistreated. Furthermore, foster children with disabilities are given less access to basic health care and immunizations, along with special needs services needed for their disability. Training for foster parents taking on these children with special needs is not provided during the initial interviewing process, and community resources are typically not provided by the state to assist the foster parents with accessing services for their disabled foster child. A study conducted by Orme, Cherry, and Cox suggested the use of a standardized evaluation, the Willingness to Foster Scale, Disabilities and Medical Conditions, or the WFS-DMC, to assist in identifying foster parents who will be a better fit for a foster child with special needs to ensure longer-term placements, along with increased quality of life outcomes. Foster children with special needs deserve the same chance at success in their adult life as their peers, and identifying foster parents who will give the proper care can make a large difference in future outcomes. In Austin, there is a program called PRIDE, or the Parent Resource for Information, Development, and Education training that new foster parents have to go through during their interviewing process to become a foster parent. And this training program addresses child detachment, loss and grief, discipline, behavior intervention, abuse and neglect, sexual abuse, working in the child welfare system, and the effects of fostering and adopting a foster child. For children who are considered disabled, foster parents have to complete between 30 to 50 hours annually of this training, but the program does not verify that foster homes that care for these children are actually receiving the treatment services for their child. Project rationale and significance. I believe this project needs to be done in order to better meet the needs of foster parents and foster children with special needs. This project will allow the parents to have a resource guide to turn to if necessary, and will improve the care the children receive. By empowering foster parents through an educational tool to understand their community resources and what their foster child with special needs requires to become successful in their adult life, we can decrease foster child displacement and increase quality of life outcomes. The following are my learning objectives for this capstone project. I will learn the incidence and prevalence of foster children placed and awaiting placement with and without disabilities. I will learn the requirements for becoming a foster parent. I will learn the resources currently provided to foster parents raising foster children with special needs. I will research how to conduct a scoping review. I will become familiar with the fostering system at Texas Child Protective Services in Austin, Texas, where I hope to complete my experiential component. I hope to understand the current training foster parents receive when applying to become a foster parent, and I will understand the process of choosing and accepting a foster child. The following are my outcome objectives. I will produce a scoping review discussing the literature, reviewing foster parents and foster children with special needs, and I will develop an educational tool to educate foster parents fostering children with special needs to improve functional and developmental outcomes. The following are a list of my references for this presentation, and I hope y'all enjoyed. Thanks so much. Can't wait to hear your feedback.